Hello, I'm Dr. E. Barry Gordon, and this is the first in a series of over 24 informative videos which will tell the truly incredible story about a very unique disease. This disease afflicts adults of all ages. It can begin as early as late adolescence, but with increasing age becomes so common that all of us eventually suffer from it in some way. It slowly but relentlessly erodes our physical and mental health. It robs us of our strength, our energy, our vitality. It incites or aggravates many other serious diseases. Its onset is, in fact, the beginning of our decline into old age, infirmity, and death. Amazingly, with all this, very few people even know it exists. The medical community as a whole rigidly ignores and neglects it, turning a blind eye to signs and symptoms of this disease that are right under their noses every day. Obviously, all this has to sound far-fetched at best. But through these videos, I'm going to lay this disease out before you, step by step, detail by detail. Watch them before you decide. The disease is testosterone deficiency. Because of its wide-ranging effects on health and on so many other diseases, I believe it is one of the most serious conditions to affect adult men and women. My goal in preparing these videos is to raise public awareness of the existence of this disease, to open the eyes of men and women to the fact that many of the things that are bothering them, physically and mentally, that many of the conditions that afflict them may well be caused by or worsened by testosterone deficiency. My hope is that an educated public will bring enough pressure to bear on the medical establishment to drag it out of this testosterone-ignorant dark age of medicine that we live in today. It's well known that we all lose testosterone at some point in our lives, and it should be simple common sense that the loss of a vital, strength and energy sustaining hormone is going to have some significant adverse effects on our health. Yet public information about this hormone deficiency disease is non-existent. What we frequently hear and read in the media is only about testosterone's illegal and abusive use. With these videos, I hope to correct that situation. It's important that right now, at the outset, you fully understand the magnitude of the difference between how much testosterone is taken when it's abused versus how much testosterone is needed to replace a deficiency in the hormone. Many male professional wrestlers, bodybuilders, athletes can take more testosterone in 2 weeks than I give my male patients in a full year. The difference in women is even more striking. In some cases, a 1-week supply of testosterone for a female bodybuilder would be enough to treat a deficient woman for 5 years or longer. There's a good example in medicine that illustrates the difference between taking a hormone in a dose needed to replace what is missing and taking that hormone in megadoses. I'm referring to cortisone, a vital hormone secreted by the adrenal glands. If someone develops a deficiency in cortisone, a potentially fatal condition called Addison's disease, the replacement dose of cortisone needed to remain alive and healthy is about 5 or 6 milligrams a day. As is also the case with testosterone, there are no side effects to taking the proper physiologic replacement dose of cortisone. Cortisone, however, is also used to treat and control some very serious diseases. People often have to take 100 milligrams a day or more. In those doses, cortisone can cause horrific side effects: diabetes, osteoporosis, severe muscle weakness, obesity, mental changes, major weakening of the immune system, among many others. You would do well to put anything you've ever heard or read or thought about testosterone out of your head and approach learning about the hormone and its deficiency state with an open mind. You should want to know something about me. I graduated from the Chicago Medical School in 1965. My postgraduate training was in internal medicine and hematology, blood diseases. I spent some time as chief of hematology at 2 hospitals in Brooklyn, where I still practice, and I also spent a couple of years teaching at the State University of New York Downstate Medical School, where I was a clinical instructor in medicine. I've spent a great bulk of my career, however, in primary care. I've been in private practice close to 40 years, but it was only about a decade or so ago that I happened to see a case in consultation that alerted me to the possibility that there might be a lot more to deficiencies of testosterone than I had ever imagined, that the true nature of the disease of testosterone deficiency might be of enormous magnitude. Since then, I've enjoyed a continuously expanding involvement with the diagnosis and treatment of the disease. I've experienced one revelation after another as I treated hundreds of patients. I've also had the satisfaction of seeing many dozens of medical studies from major institutions come out with findings which support most aspects of my vision of the disease of testosterone deficiency. On the other hand, it's been a constant source of frustration that the medical community at large remains blind to such a devastating, yet really common sense condition. I plan to release these videos about once a week. In the second, I'll answer some fundamental questions. Who is it that should be interested in this subject? Who does testosterone deficiency affect, and at what age? What are the conditions and diseases that are caused by or aggravated by testosterone deficiency? I'll also give you a preview of what is to come in the videos that follow. In the meantime, go to my website, www.thehiddendisease.com, www.thehiddendisease.com. There's a lot of information there, including abstracts of all those medical studies I mentioned. I'll also be posting this video series as they are released. Finally, if you think this video series might be of any value, do your friends and relatives a major favor. Tell them about it. Arrange for them to see them. And help me spread this information. Email this video and those that follow to everyone in your address book and ask them to do the same. I'm Dr. E. Barry Gordon. Thank you for watching.